Hi, welcome back to ante. Today, we're going to discuss the case of Moore versus the Regents of the University of California. John Moore was a patient of Dr. Gold, who practiced at the UCLA Medical Center underneath the Regents, the university hospital system at UCLA, which then fell up to the Regents of the University of California. John Moore had leukemia. He was being treated for leukemia at the UCLA Medical Center by this doctor, Dr. Gold. And he lived in Seattle. So he saw fit to travel to Los Angeles for his medical treatment because of the quality of the treatment there. So over a span of 7 years, he traveled from Seattle to Los Angeles to receive treatment. Over this time period, Dr. Gold withdrew blood from John Moore to take that blood. And at this time, John just thought it was a normal part of his procedure. He didn't know what was going on with the blood. He just thought it to be normal. At the time, Dr. Gold was using this blood that had been withdrawn to develop a new cell line. And with the university and a couple other doctors and a genetic institute, he patented this cell line and made hundreds of thousands of dollars off of it. You can imagine when John Moore found out that his cells had been used to develop a new cell line, that he probably was a little bit confused, especially when he found out that Dr. Gold was making hundreds of thousands of dollars off it. So he brought suit against Dr. Gold and the university hospital system in the California state court system. He brought 13 claims in total, but there's 2 that the Supreme Court discusses in its ruling. So those are the 2 we're going to discuss as a breach of fiduciary duty, which John Moore's attorney didn't really bring forward. It's actually a claim that the court just addressed to him. And the claim that he did bring forward was a tort of conversion. And that was brought forward by John Moore. And a tort of conversion is a tort that protects people's personal property from inference. So now that we've got the facts down, let's go ahead and jump to the ruling of the Supreme Court. So the Supreme Court of California ruled against John Moore's claim of the tort of conversion. And it did so stating that because John didn't have a true interest in his cells after they had been removed from his body, he couldn't bring this tort. It would have been a new and innovative way to apply the tort of conversion. And the court didn't want to take this time, use this case to stretch the definition of the tort of conversion so far. They said that he didn't have a real interest in the cells once they left his body, so it was impossible for them to bring, for John to bring a tort of conversion against the university hospital system. For that tort, you do have to actually have real and tangible interest in the property. So Mr. Moore lost in that sense, but the court did address that he had a pathway to remedy, and that was through a claim against Dr. Gold and the University of Hospital System for a breach of fiduciary duty. They said that because Dr. Gold didn't let John Moore know that his blood was being used to develop a new cell line, that this was a lack of informed consent, and he could bring suit for a breach of fiduciary duty. Let's read the court's verbiage here, which says, a physician must disclose personal interests unrelated to the patient's health, whether research or economic, that may affect the physician's professional judgment, and a physician's failure to disclose such interests may give rise to a cause of action for performing medical procedures without informed consent or breach of fiduciary duty. So they ruled against Moore and sustained the defendant's demurs in the lower court for all of the claims that he brought, but they said, hey, here's this pathway for remedy. You could bring suit for a breach of fiduciary duty. So now that we've discussed the posture of the case, the ruling, along with the facts of the case, let's go ahead and think about the ex ante implications of the case. First one I want to think about is one that the court certainly thought about, is that do we want to incentivize doctors to do research on excised tissue from a person's body, or do we not want to incentivize that type of activity? I think the court found a middle ground. They said that we do want to incentivize that type of activity, but we need to ensure that patients are notified that if research is going to be done, the patients need to be notified. So that was the middle ground that they drew. The reason why we want doctors to research on excised tissue is because it results in more treatments. This is a positive thing for society and for the medical practice as a whole. We need more treatments. As more diseases come in, we want positive, outcomes for patients at hospitals. So that would be the reason to allow doctors to research on this excised tissue. The reason why that needs to be reined in and why the court did that in this ruling was because if doctors don't need to let their patients know about research being conducted on their excised tissue, it does create a kind of a dark incentive for doctors to go ahead and just perform procedures with bad intentions, right? Like a doctor might say to me, if I had leukemia, let's remove your spleen. And I would think, I trust my doctor, let's have my spleen removed, it's gonna help my leukemia. But in the long run, the doctor just wanted my spleen removed so he could go ahead and conduct some research on it. So that's the dark side of the incentive, especially when doctors like Dr. Gold are getting paid exorbitant sums of money for the results of the research that was produced. Because the court ruled the way it did on the tort of conversion, I'm not sure that they completely eliminated the dark doctors from doing what they'd like to do. That's because as long as doctors inform their patients through some means, whether that be through a small waiver or just a verbal notification that, hey, we're going to research this blood, then they're kind of in the clear, right? The doctor's real intention for removing my spleen might be to research on it. But if they say, hey, Alex, we really need to remove your spleen, we got to do this next week. And they tell me, once we get it out, we're just going to do some research on it just to see what we can see about it. But in essence, what if their real intention was just to get the spleen out to do the research on? I didn't really need to have it removed. So that incentive isn't really removed because the court didn't accept the cause of action on the tort of conversion. So I think that's something to really think about in this case. Should they have ruled differently on the tort of conversion in order to prohibit that type of activity? Of course, there's a negative aspect to that, right? We do want doctors doing research on excised tissue. It's good for society as a whole. So it's an interesting ground that was walked, and an interesting tightrope that was walked by these justices in the case. So I think that's one of the most interesting ex ante implications, but I do want to just draw up another hypothetical, and it's not super hypothetical. Let's think about the Alphabet Corporation. So the Alphabet Corporation owns 23andMe. 23andMe is a genetic compository, basically. What people do is send them their spit or some type of genetic information, whether that be hair, to a lab. And then geneticists at this lab go ahead and analyze that data, tell this customer where they're from. Let's say you're from this place, that place, that place. You're 10% from this region, 20% from this region, on and on. That's the perfect purpose of 23andMe. However, if 23andMe wanted to go ahead and profit off someone's genetic information, in accord with Moore versus Regents, there's nothing stopping them from doing that. They could go ahead and, as long as they put a slip in that person's, say they get sent a saliva tube, as long as they put a slip in that said, with this information, we also will conduct research. Well, that's informed consent at that point. If you put that in a spot where it had to be read, and you then began to spit in the saliva tube, sent it off, now the court would have to rule under this precedent that whatever money is made by 23andMe off of your genetic information doesn't matter because you didn't have a real interest in that genetic info after it left your body. I think that it's a little bit concerning that you have no control over your genetic information. It's what's most uniquely you. Doctors, and I think geneticists would say that no human genome is alike another. They might be alike, but nothing is identical to another. So it is really what makes you uniquely you. And if you just have some type of informed consent, whether that's a small waiver, whether that's a checkbox on a website, under Moore versus Regents, 23andMe can go ahead and do whatever they'd like with your genetic information and profit off it however they'd like. So that's another ex ante implication of this case. We'd have to see how that shakes out, maybe in the federal system or in different states, but it would definitely have persuasive power here, as is the Supreme Court of California that handed down the ruling. So a few things to think about. If you think of any other ex ante implications, go ahead and leave them in the comments below. Thanks so much for watching, and I hope